The following special presentation of your Hometown Health Connection Community Conversations, Heal, Talk, Act, is presented by Buffalo Healthy Living Magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health, and WBBZ-TV. Hello, I'm John DeSciullo. Welcome to a special community conversation about monkeypox. Just when we thought we were getting a handle on COVID-19, suddenly we're contending with a new disease. The last time we checked, there were more than 41,000 cases of monkeypox worldwide in 76 countries, with more than 40,000 cases in countries that haven't historically reported the monkeypox. The CDC has declared monkeypox a public emergency, and with more than 14,000 cases in the U.S. alone, our country accounts for nearly a third of all the cases recorded to date, with New York and California seeing the highest number of cases. We're going to talk about how viruses like monkeypox arise, how concerned we should be, and how to protect ourselves from getting it. We're also going to talk about the stigma that is now being associated with monkeypox and the danger that that stigma represents as well. Now, joining us through Zoom technology from Houston, Texas, is Dr. Peter J. Hotez. He is co-director of the Texas Children's Center for Vaccine Development and professor and dean of the National School of Tropical Medicine at Baylor College of Medicine. An internationally recognized physician scientist, Dr. Hotez has dedicated his entire life's work to preventing and treating neglected tropical diseases and to vaccine development. Fortune magazine named Dr. Hotez as one of the 34 most influential people in healthcare. And this year, he and his colleague, Dr. Maria Elena Bottazzi, were nominated for the Nobel Peace Prize for their work in developing and distributing a low-cost COVID-19 vaccine to people in the third world and developing nations. Dr. Hotez makes frequent media appearances nationally and internationally about COVID and monkeypox. He has appeared before Congress, recently met with the White House Coronavirus Response Coordinator, Dr. Ashish Jha, and chances are, if you regularly watch one of the popular news channels, you'll see Dr. Hotez talking about COVID and monkeypox, and he, of course, was appearing on our program a few months ago. Alexandre Burgos is a partner in the Upstate New York Black and Latino Pride, an award-winning advocate and champion for change. Burgos focuses on health, equity, and in our most vulnerable communities. He was recently recognized by Business First as a 30 Under 30 award recipient for his commitment to racial and LGBTQ+ health equity. Born and raised in Buffalo, Burgos graduated from SUNY Empire State's School of Psychology and is proud of his dad, a U.S. Army veteran business owner, and his mother, a lifelong educator. So we welcome you both to this special half hour. Dr. Hotez, I'm going to start with you. What is monkeypox? Where did it come from? What is it?
Well, monkeypox belongs to the orthopox family of viruses, and the best known one, of course, is smallpox. It's important to mention at the outset, because the word chickenpox has the word pox in it. People think it's like chickenpox. It's not. Chickenpox is actually not an orthopox virus. It's a herpes virus, similar to Epstein-Barr virus or some of the others. So it's quite different. It started to appear on the African continent more frequently after the effects of smallpox vaccination began to wear off. So we stopped vaccinating against smallpox sometime in the 1970s for most of the world, because by then it had been eradicated. And now gradually we're starting to see an increase in monkeypox cases because the effects of that vaccination are wearing off. And it's happened first in the Democratic Republic of Congo, and now there's a second variant of it in West Africa. And the big surprise, and unfortunately, is over the last year, we've seen an explosion in the number of cases in Europe and North and South America, which, as you point out, over 40, 50,000 known cases, and probably the real number is 2 to 3 times higher, with at least 15,000 cases so far in the U.S., and the numbers are going up pretty rapidly.
So why is the U.S. experiencing that uptick in cases, and is there an explanation for that? And why is monkeypox appearing in countries that have never before seen the disease, too?
Well, I think part of it has to do with the fact that it emerged in a social network of men who have sex with men. So in the gay and bisexual community, particularly with significant numbers of partners, and I think it's partly a coincidence that it happened to get into that group initially, but it's because of behavior. It's spreading pretty rapidly throughout those populations, at least initially, in Europe and North America. So of in the U.S. and in Europe, of the 14 or 50,000 cases in the U.S. and Europe respectively, over 95 and some say 97, 98, 99% are in men who have sex with men population. Although eventually, as the numbers continue to increase and the force of infection rises, we should expect to see spillover into other populations as well. And so that's the key, is to try to vaccinate and treat the initial population as quickly as possible to get our arms around it in order to prevent spread to more generalized populations. And potentially, now that monkeypox is in the wastewater in countries in North and South America and in Europe, you always worry about getting access to the animal populations as well. So there's a big push right now to work as quickly as we can to treat and vaccinate as many people as possible, with the constraints of the availability of those vaccines and treatments.
We're going to get Alex in on the conversation in just a second, but I did want to ask Dr. Hotez, if monkeypox is transmitted from person to person, and you're saying in men who have sex with other men, what would make that different from a man having sex with a woman if it's person-to-person contact? And of course, then what are the symptoms, and what should we do once we think we have it?
Well, that's right.
I'm just curious about that.
And I think we can expect the possibility of transmission from men to women eventually as well. And I think exactly how the virus is being transmitted between individuals. There's some differences of opinion. Many think it's through close skin-to-skin contact, because those pustules that people have seen pictures of people with monkeypox contain a huge amount of virus. So if there's a rupture of one of those pustules through rubbing or skin-to-skin contact, that releases a lot of virus, some of which could be in the atmosphere, but instead a lot of the virus might enter another person through a microabrasion of the skin. It's also oral to skin contact as well, and that's a second route. And then the third is when you're releasing a lot of virus, either because the virus is also in the mouth or released from a pustule in the skin, it could land on mucous membranes of the nose or mouth. So that could be yet a third mode of transmission, and some combination of that. But the key is it's fairly intimate, close contact. This is not something that right now, at least, does not appear to be through casual contact. So for instance, if you remember a week or two ago, there was a teacher or a person in the classroom in a preschool in Illinois who had monkeypox, and there was a lot of alarm expressed that this could, now the kids, the preschool kids could get infected with monkeypox. Well, it didn't happen, and I didn't think it would, because it really does require pretty close and intimate contact. So it's not transmitted to anything of the level, say, of COVID-19. That's point one. It's not nearly as easily transmissible. Second, it has a much longer incubation period, meaning the time from you're exposed to the virus to you show symptoms is not like 2 or 3 days like it is with these new COVID subvariants, but rather 2 to 3 weeks. So it makes contact tracing a lot more feasible. And lastly, unlike COVID-19, where it took a year into the pandemic before we had vaccines, now, even though they're limited availability, we already have a vaccine available that we know is fairly safe. And we also have antiviral drugs, and we can talk about some of the pluses and minuses of how to use those vaccines and antiviral drugs in order to stem this outbreak.
And I hear that it could be a painful experience for those who are with the monkeypox, and it's sort of a scab that creates a rash and then it flakes off eventually. It's not a death sentence, but it certainly isn't something you want to get.
Well, it does have very low mortality. There have been a couple of reported fatalities, unfortunately. You know, the version in Central Africa, in Congo, DR Congo in Central Africa, the mortality rate was about 10%. The other variant that's in West Africa that seems to be more in play here in Europe and North America is about 1%. We're not even seeing 1% case fatality rates. But the worry is if it gets into populations of individuals who are immunocompromised or kids, we could start approaching that. So right now, fatalities are few, but it's an awful, awful disease. I mean, the pain and is very debilitating, and the rash is frightening for many, and there's a lot of social stigma attached to it. So and sometimes the pain and the rash are severe enough that it does require hospitalization. So it's an extremely unpleasant and debilitating disease. It also requires you to have isolation for prolonged periods, so you miss work. So it has a lot of socioeconomic implications. And so one of the things I always point out, in any epidemic or pandemic, is people tend to focus on mortality and make decisions on the basis of mortality. But there's a lot of things infectious diseases do that go beyond death that are still pretty awful, and we need to recognize that as well.
Well, let's talk about one of them being the stigma that's associated with this. And Alex, will bring you into the conversation. As a member of the LGBTQ plus community, how are they reacting to hearing this news, and what are you doing and what are they doing in the community to work forward to prevent this?
Well, I think for many people, this can be, especially our older population, this can be a moment that is very re-traumatizing and can sort of be viewed as history repeating itself. I think in many ways, this is only a continuation of the trifecta of a public health crisis, that being homophobia, which exacerbates the disparities that our community already faces. I think many people see the stigma and the news surrounding monkeypox as a way to scapegoat and attack our community. And I think many members of our community feel as if this is another it's a continuance of an attack that we've been facing, for generations and decades on end, just repackaged and repurposed. I think in terms of avoiding stigma, I don't think that there's really a way to avoid stigma at this point. I think now what we can do is address it, right? And we address stigma through education, through advocacy, through awareness, but most of all, through being proud. Because at the end of the day, what they want for us is to feel shame. And the opposite of shame is pride.
It's interesting you bring that up, because Dr. Hotez, how do you connect, because I know you don't like to kind of add the word stigma to this, but it's impossible not to. How do you react to what Alex just said in respect to the stigma that's associated with monkeypox if you contract it?
Yeah, I think Alex was very eloquent in the way he expressed that, and I wholeheartedly agree. And I'll tell you, there's another piece to this, which is that there seems to be disproportionate impact on not only the gay and bisexual men, but gay and bisexual men of color as well. So we have to layer that on, and there's always the element of racism that goes with it as well. The bottom line is, I think there needs, I think Alex is absolutely right. The way you manage this is through education and compassion, and the very practical matter of how we can accelerate the number of doses of vaccines that we currently have in hand, and also looking at some of the antiviral drugs. So when you're ready for me to talk about that, I'll do so, but I didn't want to lose the current thread.
Well, we'll get to that in a moment, but let's pick up on the community, again, the LGBTQ plus community. Are they aware of the vaccine? Are they aware of this at all, Alex? Or is this something that they're looking at as like, well, that's happening in another place, and it's not happening maybe here in Buffalo or in their own community?
Well, I mean, again, I think that there are many factors that go into it, one of it being where you live. So places that are less open and less receptive to the LGBT community may not have that same outreach and engagement. You know, we live in New York State, at least I do, and we're very fortunate to have a state government that is very adamant about getting the word out there and educating our community. You know, I think that in terms of how to access the vaccine, that could be something that's up in the air for a lot of people. You know, for me personally, when I have done my outreach and continue to do my outreach, many people don't know how to access it. And I think Dr. Hotez mentioned a really great point about communities of color within the LGBT community. When you have that added layer, language barrier is something that is oftentimes not factored in. And that's something I've also worked to address locally. But in terms of the knowledge and the availability of the vaccine, I think we still have a long ways to go.
Well, and so Alex gave us that opportunity to now dovetail into the vaccine itself and what you're doing, Dr. Hotez, to help develop and coordinate that with the research. What do we need to do to vaccinate ourselves to prevent this, and what is the vaccine like?
So the vaccine, which goes by the trade name of Jynneos, it's made by a European company known as Bavarian Nordic. It was a vaccine that was actually authorized and approved in 2019 before the pandemic. The problem with it is we had a pretty good stockpile of the vaccine. It wasn't stockpiled for monkeypox, but it was stockpiled for fear of a bioterrorist attack due to smallpox, because after the breakup of the Soviet Union, we learned that the USSR had a pretty aggressive smallpox weaponization program, and the worry was that it had gotten to the hands of the North Koreans and the Iranians, etc. So the U.S. responded. That's how the basis by which BARDA was created, the Biomedical Advanced Research Development Authority. People know it for its work on COVID-19 vaccines, but it was actually set up initially for smallpox and anthrax vaccines. Well, with this vaccine, we had 20 million doses stockpiled, but tragically they were allowed to expire. So this was an unforced error that happened a few years ago. So now we're trying to play catch up and get as many doses out as possible, and that's been problematic. So one of the ways to approach this is there has been one study done on around 500 individuals showing that you could do dose sparing or fractional dosing, meaning give about 1/5 of the dose you would give by the usual immunization route by giving it within the skin, an intradermal immunization that would resemble when people get a TB test. You know, you get that little bleb of when you do an injection with a small needle directly into the skin, it blebs up. And the thinking is if you could vaccinate that way, we could maybe vaccinate 4 or 5 times as many people. And so that's being looked at currently right now, and that's currently going to be one way to proceed until the hope that we can get more vaccine in place. It's based on a small study, and that does give me some pause for concern, although I think it'll work out okay. It's not going to go all that smoothly. Another approach is we have what looks like a very promising antiviral drug against monkeypox. It's known as tecovirimat, goes by the trade name of T-pox. And anecdotally, we're hearing it really gives a rapid turnaround in terms of how sick people look and feel in terms of feeling better within a couple of days. So if the clinical studies bear that out, that's potentially good news. And then it also means we could look at alternative uses potentially of that medicine. So for instance, rather than just treating somebody who has active lesions, could you give it through what's called post-exposure prophylaxis, meaning someone that's been exposed to someone who's known to have monkeypox? Could you give that to them in order to preempt the appearance of lesions or mitigate the severity of illness? So that's something that's being looked at. And then it's also being looked at as a form of what's called pre-exposure prophylaxis, or PrEP, meaning individuals, let's say in the gay and bisexual community, who know they're at risk because of partners and contacts. Could you, almost like we do with HIV, antiretroviral drugs, give it as a form of PrEP? And so that's being looked at as well. And I think that's extremely important, because if indeed we're not going to have a lot of vaccine available in the coming weeks and months, being able to use tecovirimat as a form of PrEP or post-exposure prophylaxis could kind of get us over that hump over the next few months. So all of this is ongoing, and it's never easy trying to optimize or design new therapeutics and vaccines in the middle of an epidemic, but that is the reality that we face.
And part of the criticism of this, Dr. Hotez, is that there might not be enough being done at all. You mentioned the vaccine and maybe not having enough of it. Are we, and I don't want to politicize this because I don't want to put you in a spot, but does it seem like that we're a little behind the curve with this, and are we taking it as a population, are we taking it seriously based on what Alex said, because it's now in its initial stages finding its way with a certain population that some people will just be very prejudiced against?
Well, no question, we're behind the curve, and there were a lot of unforced errors that were actually in place well before the monkeypox, before this current epidemic, and even before the COVID-19 pandemic. So there's not too much we can do about that, but at this point, but the question is how we best play catch up, and how we look at the fractional dosing of the vaccine, whether we can rapidly turn tecovirimat into a form of post-exposure or pre-exposure prophylaxis. I think the White House has made a good appointment with the new monkeypox coordinator and deputy coordinator. I don't know them personally, but I've heard their interviews on some of the cable news channels, and I think they seem to have they understand the pressures and how to balance expediency in terms of getting these measures out, countermeasures out, without compromising safety, and doing this in the right way in terms of clinical trials. But it's going to be a race. I think, the other piece that concerns me is, the U.S. there's no question they're hoarding a lot of the vaccine. And we all said, hey, we're not going to let that happen again after what happened with COVID-19 vaccines. Well, of course, that's happening. And we have to remember that this is now a global problem. We have it in Europe. And if you look at where the cases are very high in Europe, in addition to the UK, they're quite high in Portugal and Spain. And when I see that, to me, that's a red flag for worrying about Latin American countries, and especially Brazil, because historically when a virus like HIV/AIDS or Zika gains a foothold in Brazil, it really takes off. So I'm looking at this not only from the standpoint of the US, but really a true global health problem. And I worry about the establishment of monkeypox in the Latin American region, just like it did with Africa. So we have layer upon layer of complexity with this problem. So things are getting complicated very quickly, and the numbers are continuing to accelerate.
Well, from your global viewpoint, let's bring it now to our local viewpoint. Alex, I know there's Evergreen Health in the city, and
Yes.
What are some of the other clinics that people can go to, not only just for monkeypox, but they may feel that they need to go to a clinic to check themselves out? And what are you hearing in the community about people going to seek some advice in medical care?
Well, I think as it pertains to the LGBT community, Evergreen Health is the most qualified and fit to lead and serve our community. And I think that they are a trusted source in our community. In terms of accessing the vaccine, we are moving it to the Evergreen Health location on Bailey Avenue. So that will be starting this week for folks to get their first dose, and then they'll be able to get their second dose there as well. So I think that, Evergreen is leading the way. They're one of the organizations that's leading the way in, spreading information and making the community feel like they can go and ask questions. I think, again, bridging that education gap not only is necessary within our community, but also within our organizations. So as folks that are leaders in the community that have connections to those organizations, making sure that trusted organizations across various communities are informed, prepared, and ready to handle should people have questions and concerns.
Well, we are here, and you can look right into that camera and ask a question to Dr. Hotez if you'd like, because we're together here. And what would you like to ask Dr. Hotez, Alex, if you had something to say?
Well, I think the first thing that comes to mind is how can we implement national response on a local level, on even more so on a community level?
Well, I think, one of the things that I'm a bit concerned about is, moving into this fractional dosing. We're doing this on the basis of 500 individuals. I think it's likely going to work. But, to move from a 500-person study to implementing a program on a national level, I think is a bit audacious. And one of the things, not only from an effectiveness point of view, but also a safety point of view, because that bleb in the skin gets integrated pretty quickly. And so I would have liked to have seen the White House and the coronavirus and the monkeypox task force maybe look at a pilot city to really roll this out first, and work out some of the technical issues in terms of how you do the intradermal immunization. So I think it was pretty audacious to move right to a national program on that. I think likely it will go well. It's just that if it doesn't, we've seen how fragile vaccine confidence is in this country, and so I am worried about that. So I think the key is trying to enlist community, from my perspective as a researcher and scientist, getting community participation in doing some of these alternative fractional dosing of the vaccine, the post-exposure prophylaxis use, the PrEP use, and understanding of the urgency in participating in those kinds of research studies, I think, are going to be extremely important. I think everyone's worried. We want to get our arms around this as fast as possible, but I think that's going to be important. I know the White House coordinator has mentioned about limiting sexual partners, at least for now, until the monkeypox cases start to decline. Alex, I'd be curious to hear whether that's resonating with the community and how we message that. And again, it's extremely delicate to do this in a way that doesn't shame or stigmatize, and whether you think the White House is kind of striking that balance at this point.
Right. And you bring up a very good point. It's a very difficult fine line to navigate, between wanting to be, sex and choice positive, while also acknowledging that there is a public health crisis that, from a public health professional perspective, we need to do everything possible to prevent the spread.
Dr. Hotez and Alex, first of all, Dr. Hotez, thank you for the great work that you're doing. We're almost out of time, and please say hi to Dr. Patazzi for us, because you were here when we talked about COVID-19. And by the way, you can help Dr. Hotez and his team. There's a donation page for the Texas Children's Center for Vaccine Development, texaschildrens.org/vaccinating-the-world, or Dr. Hotez's website, which is peterhotez.org. Dr. Hotez, thank you very much for joining us.
Thank you, and thanks for all your great work. And Alex, it's great to meet you, and thank you for your hard work in the community. It's so important, because you could have all the science and medical innovations in the world, but if we don't have people like you out there, it's nothing. It goes for naught.
And I want to mention that Alex has some information as well, whether it's monkeypox or any other issues concerning the LGBTQ+ community. I know you have some social media pages for the Upstate New York Black and Latino Pride. It's on Facebook and Instagram, and that's the /UNYBLP. So thank you, Alex, for joining us.
Thank you so much.
All right, and we thank you for watching your Hometown Health Connection on this very important topic. We'll see you on the next edition of our program. Thanks to Annette Pinder and Buffalo Healthy Living Magazine. This special edition of your Hometown Health Connection Community Conversations, Heal, Talk, Act, was presented by Buffalo Healthy Living Magazine, with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health, and WBBZ-TV.